my cancer story, 20 years ago, today. I know it's been a while since I checked in, and that's because I really wanted to honor where I am today. And that is, this past week, I was on vacation with my family, completely disconnected. This past week, 20 years ago, however, was very different. 20 years ago, July 28th, 1999. This week 20 years ago was an absolute whirlwind. The day after my diagnosis, I was transferred up to City of Hope Hospital. A few people came to see me at the hospital I was at before I was transferred up. As soon as I was transferred, they let me know what type of cancer I had, acute myeloid leukemia. They drew 9 vials of blood, and they were kind of telling me what was going to happen the next few days. And the treatment would have to start as soon as possible. My mom asked, can treatment wait? Can her eggs be fertilized first? The doctor said no, there is not time. With this type of cancer, we need to treat it as soon as possible. Then he said, also with this type of cancer and treatment she's going to have, it's very rare that she'll lose her fertility. As wonderful of a doctor as he was, and I was with them the entire time that I did all my treatment and also all my post-treatment as well, I really wish he just would have flipped those two statements around, because it would have made a difference. It would have, I think, normalized it a little bit more, made it a little bit less scary for me that I had to start treatment right away. And this week was just day by day by day. It just happened so fast. When I was transported to City of Hope, I still had my hospital stuff on. I didn't even have any of my own clothes. We didn't think to bring my own clothes up to City of Hope. And when I was there a day or two, probably just a day, I asked my family, can you please bring me up some pajamas and a few of my other things, just so I wouldn't have to wear the itchy hospital gowns anymore, because I wanted some sort of comfort from home, however small it would be, so that I could really start to feel at home where I would have to be for an extended period of time. So the day after I was admitted to City of Hope, I had a chest x-ray and also a brain scan. The chest x-ray was to make sure that they could put a central line in to start chemotherapy as soon as possible. The brain scan, the CT scan, was to make sure I had no bleeding in my brain. Since I was bruising everywhere in my body, there was concern that there was extra bleeding in my brain as well. And I also had another bone marrow aspiration. Realized today I don't even really remember all of this in detail. The reason why I remember this in a little bit more detail is because I've been going back and looking through my journal that I kept very sporadically at that, and also the scrapbook that I made. These two pieces really helped me process what was going on during the time, and I can tell you what seemed so important and the people who were so important in my life at that point in time. Some of them stayed very important to me, and some of them I don't even remember. Like some people I met in the hospital, I don't remember them. I just remember from my journal. But what I remember is it being so fast this first week. So as soon as that central line was clear, they did another x-ray to make sure that it was functioning properly. I started chemotherapy. The nurse came in, who I had seen 2 days prior or every day prior since I'd been at City of Hope, and she was wearing this blue gown with gloves. And it was really scary because it wasn't explained to me that the nurse would have to wear this as part of their protocol when they administered my type of chemotherapy. If they just would have gone that extra step and told me not only what type of chemotherapy I was going to get, how long the duration was, which they did, how many rounds I would have to have, which they did, but that one little step of someone who has been treating you, an awesome nurse who has been coming in to see you every single day, multiple times a day. When she comes in for chemotherapy, she's going to wear additional coverings because it's our protocol here. I just wish they would have let my family and me know that that was going to happen, because that was really alarming. That was what was going to be entering my body that was so toxic that the person who was administering it had to wear something a little bit different. The chemotherapy I had really didn't affect me that day. It wasn't until the following day when I felt really tired, had worse headaches, and had a little nausea as well. I was also on a vitamin A derivative that caused my headaches to be even worse. And so when people would come up to visit me that week and beyond, sometimes it was challenging to visit with them because my head would just throb. And I wrote in my journal, like, I just wanted to push people out the door sometimes because I had such a bad headache. And this isn't every time. This is just when I wasn't feeling really well. And what's hard is when people come to visit you from an hour from where you live, or even from out of state, as some people did, it's hard to tell them they need to leave because I need rest, because I felt like they are trying to come see me and support me. But it was also challenging not getting the rest I needed sometimes. There were other times when people came and it was just what I needed. I needed some distraction because maybe I was having a better day. And I was able during this first week to still walk outside. And at City of Hope, they had this little Japanese garden, I believe, with a koi pond. And I had what I called my chandelier, which is really just our name for the IV pole with all the medicine attached to it. And I was just going to walk outside, and then we started exploring more. And there were these cobblestones, and my dad and one of our friends had to pick up my chandelier and walk into the koi pond area so I could explore. And it was just a lovely experience to get outside of my hospital room where I was pretty much most of the day for a variety of reasons. Either I wasn't feeling well, or I was getting some sort of treatment where I needed to be there. And this first week, what I wrote in my scrapbook was that it was just a lot to get used to. Nurses coming in and out my door, doctors checking in on me at least once a day during that first week in particular, because they're wanting to make sure everything's okay. They're communicating very well with what's going to happen as well. And it was just a lot to get used to. Probably the most challenging thing to get used to that I never got used to was them waking me up at 2 o'clock or 3 o'clock to do my blood pressure, take my temperature, draw blood, and also to weigh me. And I think at one point asked, why are you doing this when I'm trying to sleep? Because many times by that point I was able to sleep. And it was because in the morning when the doctors came in, they met as a team to go over everyone's blood work and discuss their case. And although I really appreciated them meeting as a team, I didn't ever get a clear answer why it needed to be done at that hour. And it would become increasingly more challenging for me to be woken up at that particular time, just like I'm sure everyone in the same wing that I was, in the same wing where I was, were all patients who had some type of leukemia. And we were all woken up between 2 and 3 o'clock to get all of our vitals checked so that the doctors could evaluate if the course that we were on was working, if adjustments needed to be made, all of that stuff. Today, July 28th, 2019. Today, we just got home from our camping trip, and it was just an amazing week. So much different than 20 years ago. We went on a hike, and it was a 6-mile hike. It was the first time we'd gone on this hike, and there were some pretty steep inclines. And I just kept thinking to myself, I cannot believe I'm doing this. Struggling, yes, climbing up this mountain, a little bit out of breath and sweating because 20 years ago, I was undergoing cancer treatment and so exhausted, sometimes I couldn't even get up out of bed to go to the bathroom. I would wait as long as I could to walk to the bathroom because I was so tired. And so as I was hiking, I just kept thinking, this is amazing. If I would have thought 20 years ago I would be here on this day, I would have said no way, because I just had no idea that I could step back into my life this fully after being where I was 20 years ago. The rest of the week camping was amazing as well. Besides that hike, we did another hike where it was another steep incline, and I just kept holding on to the fact that I get to do this. I get to be with my family, and I have a family. My boyfriend at the time is my husband now, and we have 2 children together. Beyond the hiking, we took a lot of time to relax. I walked my dog every single morning around this loop. It was just an extraordinary, ordinary vacation for us. This week I get to go right back into my normal work week, a little bit more refreshed, a little bit more connected with my family. I hope that wherever this week takes you, you have a chance to pause and enjoy the beauty of the day. Don't forget to subscribe and turn on the bell notification. And like, share, and leave me a comment.